So what kind of evidence can we collect that would be more meaningful? Well, one of them is single subject, where you measure a person at multiple points in time, and you compare them to themselves, and this is done all the time in behavioral therapies. Well, there's several different ways. Like I have a single subject study going. Well, I'm closing it up. It's studying how babies develop autism. So I did very intensive measurements, but I didn't have a boatload of money. So I had 22 babies, and we tracked them for 3 years, 2.5 years, and so we don't have enough to have statistical significance with group comparisons, but we can compare the trajectories of what happened in the 8 measurements that we took over 2.5 years of blood and urine and EEG and stress. And what were the patterns of improvement or deterioration in the kids who wound up being autistic and the ones who did not? If we had 100 or 500, we could really pull out subgroups of people who had low glutathione and high visual evoked potentials were in one group, and people who had inflammatory markers and problems with distinguishing syllables and hearing things properly were in another group. I'm just making those groups up, but we would have the variables that we could start to cluster that, and that's what we're looking to do with the open medicine thing, where we're looking to put together a cohort of 2,000 people with autism with a lot of different measures, and then you pull out. You have enough, you can cluster people. And you're clustering them based on what they are really trying to do for their own clinical needs, each of them, under maybe the guidance of a health coach or whatever they use. What makes it standard is not the intervention, but how you measure it. So the whole group is getting certain standard measures that, so then even though they're doing different things, you can see where the patterns of improvement are, and you have enough basic characterization of their metabolic status, their nutritional status, their genomics, their activity level, that those are the things that pull it together. You're not trying to railroad people through the exact identical procedures, because you're not trying to get a patent on those procedures. You're trying to get people better in whatever ways you can. And then, we'll figure out how to aggregate the data. This is newly possible between cheaper measures requiring, if it's blood, less blood or less urine than ever before, wearable electrical things, and a place to put them on the computer without a whole lot of effort, that you can upload all the stuff from your house or from a participating lab. And this has all never been possible before. Our day has come. I mean, I really think that we now have the measurement and the data collection capacities to show what we're really doing in integrative and transformative medicine. So the first step, I think, in setting up a practice like this is just saying, people came in, they were in this state. We have these measures that have some kind of validity or reliability, that we documented them when they walked in the door, and then a ways down the line we document them again. It could be at the end of an intervention, or it could be 3 months later. It depends on what the measure is. And we're showing change that can't just be dismissed as anecdotal, oh, I feel so cool, but that this measurement, that a measurable phenomenon shifted in a way that wouldn't have happened by itself. So the first thing you need to do is to do that kind of research, and then there's this phase in which you figure out, okay, so which things should I measure? And how do I get the time to do it? And how are the patients going to put up with that? And how long is it going to take? And are they going to understand why we're doing it? And who in the office is going to do that? And how are we going to pay them? And, and how do we get them to do the measurements right? And where do we put the data? And all of these really important questions that you can talk all you want about research, but if you don't figure these things out, you're not going to have research. That's really foundational. It's fundamental, and each practice has to go through it in their own way. So it's kind of a tall order to get people to figure this out. But I believe that when we have a few sentinel practices that have figured this kind of thing out, it's going to become easier for other people to follow in the footsteps and find their own way. And it's like rendering unto Caesar what is Caesar's and rendering unto God what is God. So rendering unto Caesar's, you got to show some objective measures that people somewhere published and validated. You got to do that. It's just the way it is. But rendering unto God is what do we need for our own development? If we're going to go through this whole thing, it's not just so that we can show other people that we fit into their world, because we're never going to fit into their world. They need to fit into our world, and we need to just fit into our own world better. So this is a whole evolutionarily novel way of doing science that doesn't really exist yet, but all the pieces exist, but we have to put them together in a way that hasn't been there before.